Welcome back to Ask Allison. Here is today's question. I work in a large medical hospital and have over 250 clients. So I see people probably once every 3 months. I've only been out of the training portion of my career for 2 years, and I feel like I've now lost all my clinical skills just doing supportive therapy / brief check-ins. I'd love to quit and start a private practice so I can do actual therapy, but I'm terrified and single. What are your thoughts on doing something like the large telehealth companies that hire therapists as a stepping stone first instead? So first, I'd like to thank Therapy Notes for sponsoring Ask Allison. They are the #1 rated electronic health record system available today with live telephone support 7 days a week. It's clear why Therapy Notes is rated 4.9 out of 5 stars on Trustpilot and has a 5-star rating on Google. Therapy Notes makes billing, scheduling, note-taking, and telehealth incredibly easy. And now for all you prescribers out there, they also have ePrescribe. If you're coming from another EHR, Therapy Notes makes the transition incredibly easy, importing your demographic data free of charge so you can get going right away. Find out what more than 100,000 mental health professionals already know. Use promo code ABUNDANT at therapynotes.com for 2 free months. Reading your question made me feel tired. 250 clients sounds exhausting. I was afraid I was losing my clinical skills when I was building my practice too. Some of it is like riding a bike. Some of it is like learning to do a wheelie for the first time on that bike. If you're like most therapists, you've integrated clinical skills into your life and forgot about it. So one of the ways you communicate with your loved ones is informed. Some of the ways you communicate with your loved ones is informed by what you've learned. Is that the same as therapy? No, it's not, but it's a good bouncing off point to show that you know some things you may not be giving yourself credit for. You're probably a pro at treatment plans, and your supportive therapy, which we all do in session, is so well honed. Being terrified is normal when starting or considering starting a practice. I hear terrified and excited is a combo pretty much daily. Being single means you probably don't have income from elsewhere, right? So the scariest tangible part, we're going to bypass the fear of failure, etc., that a lot of us feel. The scariest tangible part is not being able to pay your bills. The most important thing is to have a plan that's based on principles that work. The worksheet for today outlines the types of plans you need to have in place. I strongly encourage you to have savings enough to pay your bills for a few months. Just the basics, and pare down your spending so you don't spend longer working 2 jobs or longer being worried about income. A few months of delayed gratification is so worth it for freedom. It also lights a bit of a fire under your butt to do the things you need to do to build. If you start a part-time practice while working full-time, save any and all the money you make in your private practice beyond whatever necessary overhead and put it all into savings, like every dime. You're not going to want to. You're going to want to use some of your private practice money for something fun. You're working your butt off. But I want you to put every dime into savings so that you can quit your full-time job sooner. I swear I'm going to answer your question. The large telehealth platforms that hire therapists can be a good option in one specific circumstance. If you are working in a place so toxic, you have to get out now, they can be an option. I want you to really know and understand their model. If it's absolute self-preservation and you have to do it, then it could be okay. The people that I have worked with who are getting out of those systems are very grateful to be getting out of those systems, much in the same way that you are describing wanting to get out of your system. I will say that. And also the data mining that they're doing, I'm under the impression that some of that is shifting and changing, but I would get crystal clear before you do any work for them about what kind of data they are mining. And if that lines up with what's okay with you and what's not. If, however, your goal is to have a thriving private practice as your income, I recommend not signing on with one of them, because 99% of the people I've talked to who've worked for them have called it exhausting. Their boundaries were difficult to manage. The pay was poor. Most people already have those dynamics in their agencies. No need to learn a whole new system to go through that transition and not get benefits for a temporary situation unless you're really, really desperate. Especially when you can build what you want and have boundaries that feel good and income you want. Because you can get your own clients if you just follow doable guidance. So today's free worksheet is a basic planning guide that's going to help you see what you're getting into if you go into your own private practice. We've helped thousands of therapists fill their practice in the Abundance Party. I know we can help you too. So join us using the link in the bio, and I am happy to help. Have a great day.